Hi, for my advanced physical assessment demonstration, I will be performing an NIHSS stroke scale assessment. This scale is used to determine severity in stroke patients. Working on a trauma neuro floor, we utilize this assessment technique for all of our stroke patients. This scale is to be used once on admission and then once daily. The scale can show progression or regression for patients who suffered a stroke. The patient is scored between 0 and 42. The goal is to have the patient score under 5. The higher the number, the more devastating the stroke. The way the NIHSS stroke scale is graded is between a set of numbers. For example, the first thing I'm going to assess is level of consciousness. So if my patient can answer the questions to the best of their ability, determine they're oriented, determine they can follow commands, they will get a 0, which means alert. Opens eyes spontaneously, able to follow commands. If they were totally unresponsive and couldn't answer my questions, couldn't tell me where we are, couldn't speak, I would give them a 3, which means totally unresponsive. Now, some things are graded from 0 to 3, others are graded from 0 to 2, and some are graded from 0 to 4. The higher number you receive, the more poorly your patient is doing according to the NIHSS stroke scale assessment. Good afternoon, my name's Chandler. I'm going to be your nurse for this evening.
Hi.
I'm going to start by asking you a couple questions. 1, can you tell me your name?
Kevin.
Can you tell me your birthday?
9/17/83.
Can you tell me where we are, what city we're in right now?
Lancaster.
And can you tell me the month?
April.
Can you tell me who our current president is?
Trump.
Great. Now I'm going to ask you to raise your right hand, make a fist. Great. You can relax your arm now. Go ahead and close your eyes. Okay. Next, I'm going to assess your, test your gaze. Yes, you can open your eyes. Now I'm going to assess your gaze. So I'm going to have you follow your eyes with my finger. Let me just make sure we can see the camera. Don't want to edit it. All right, now follow my finger. Okay, great. Oh, actually, I'll keep it over here. Next, I'm going to test your visual fields of gaze. How many fingers am I holding up?
3, 2, 1.
Okay, next, I'm going to do the other eye.
2, 1, 3.
Okay, great. Now I'm going to test your facial palsy. I'm going to have you smile real big for me, frown, puff your cheeks out, raise your eyebrows. All right, great. Now I'm going to test your motor skills. I'm going to have you raise your right arm, keep it raised, right in front of you like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great. Go ahead with the left arm, hold it straight in front of you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go ahead and relax that. All right, now with your leg, same thing. Go ahead with your right. 1, 2, 3, 4, 5. Go ahead and relax it down. Go ahead with your left. 1, 2, 3, 4, 5. Great. Now I'm going to test your limb ataxia. So I'm going to have you touch your nose and then touch my finger. Go ahead, touch your nose, my finger. Your nose, my finger. Go ahead again with the right hand, my finger, and your left again. Okay, great. Now I'm going to do the same thing but test your legs. So I'm going to have you take your right heel, put it to your left knee, and then go down your leg. Awesome. Now do the same thing with the other leg. Okay, great. Next, I'm going to test your sensory perception. Okay. With sharp and dull. So this is the sharp side of the toothpick, and then this is the dull. Do you understand?
Yes.
Okay. Go ahead and tell me.
Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. sharp, sharp, dull, dull.
Okay, great. Okay, and now I'm going to test your language. I'm going to show you a picture and I want you to describe what's happening into this picture in your best knowledge. I'm going to show the camera. This is the picture. Okay.
Mother's doing dishes, the water's overflowing. Kids want some cookies, and the chair's falling.
Okay, great. Now I'm going to ask you to read a couple of things off the paper. I'm going to have you read all the things in blue. Let me show the camera. Read the things in blue.
You know how, down to earth, I got home from work. Near the table in the dining room, they heard him speak on the radio last night.
Okay. Next, I'm going to show you some familiar objects, and I want you to tell me which objects they are when I point to them. Let me show you the objects. You can hold the phone. Tell me what this object is.
Glove,
This one?
key,
This one?
chair,
This one?
cactus, feather, hammock.
Okay, great.
It's actually cacti, but it's more than one.
Okay. Next, I'm going to test your dysarthria by you reading a couple of things off the list. I want you to read the things in pink. Okay.
Mama, Tip Top, 50-50, thanks, Huckleberry, baseball player.
Great. And lastly, I'm going to test your extinction and intonation. So go ahead and look straight at me. So make sure the camera can see it. Straight at me. What side is my hand? Which side is moving?
The left, the right, the right, the left, the left, the right.
Great. Okay, and lastly, I'm going to just ask you, what side am I touching?
The right, the left, the right, the left, right, left.
Okay, great, Kevin. Thank you very much. For Kevin's NIHSS stroke scale assessment, I graded him a 0. He was properly able to answer my questions and follow my commands without difficulty. Now, if he had some difficulty with the reading portion, which is your speech, or the sensory perception, I would have deducted a couple points. But for this, he received a 0.